The bones which are forming the skeleton of the posterior abdominal wall from top to bottom includes the ribs 11 and 12. So here is the rib 11, this one, and rib 12. The 5 lumbar vertebrae with the intervertebral discs, along with the transverse processes of these vertebrae. And then on the bottom part, we have a part of the pelvis. So let me give you a little bit more explanation here. As you may recall, the pelvis has 2 parts, or is made by 2 parts: the greater pelvis or false pelvis, which is here, and the true pelvis, which is down here. Between these two, we have a boundary right here. So a part of that boundary is the promontory of the sacrum, which is the anterior border of S1 in the midline. Then we have the ala of the sacrum. This part is ala, okay? And then on the sides, we have the iliac fossa, which is actually impression on the ilium of the hip bone. Then practically these parts are considered as a part of the bones forming the skeleton of the posterior abdominal wall. Later we will see that the muscle attaches here, iliacus muscle, is considered as one of the muscles of the posterior abdominal wall. The last but not least, that good to know that on the upper part or the roof of the abdomen is made by the inferior thoracic aperture, which is right here. And as you may recall, this aperture is sealed by diaphragm. And since diaphragm is dome shaped, then some of the muscular fibers of the diaphragm are considered as part of the actually musculature of the posterior abdominal wall. They attach here. So then practically this is, or these are the bones forming the skeleton of the posterior abdominal wall. This is another specimen that we want to use to show you the structures on the posterior abdominal wall. As always, we need to orient ourselves to the specimen. So as you can see, the GI tract or gastrointestinal tract is being removed from the abdomen. You can see the kidneys, both kidneys are dissected on the posterior abdominal wall, and then on the roof we have the diaphragm. So let's go with the orientation here. So as I said, on the roof we have the diaphragm with 2 domes. That is the right dome of the diaphragm, of course, and that is the left dome. And then in the middle we have the central tendon of diaphragm. So on the superior aspect of the central tendon we have the pericardium attaches here, and then heart sitting inside the pericardium. So then that is central tendon. And since we want to actually learn about the openings in the diaphragm, good to know that one of the major opening right here is the inferior vena, is for inferior vena cava, caval opening. Okay, and then other openings we can see them from the bottom part. Okay, now the other attachment of the diaphragm or attachment of the diaphragm to the lumbar vertebrae. In order to see that, I'm going to actually pull the right kidney to the left. Okay, and here this is structure known as right crus, and also we have another one on the left. So let's lift this, and could you hold this for me, please? Thank you. Okay, and right here, that is the left crus. Okay, then these crura forming an opening known as aortic hiatus. And as you can imagine, the aorta, which is this, passes through the aortic hiatus. Okay, thank you. Now also in the midline right here, these crura form the median arcuate ligament right there. Then in front of the aorta here we have the median arcuate ligament. We also have 2 other ligaments that in order to see them I need to actually lift the left side. Thank you. Okay, so one is here right there, which is the medial arcuate ligament, and under the medial arcuate ligament we have psoas major muscle passes underneath, and then we have the lateral arcuate ligament right here that quadratus lumborum muscle passes under. Okay, so The last opening of the diaphragm that we want to see is here, is esophageal hiatus right there. And as its name implies, that is for esophagus. And that is esophagus passes through the diaphragm. So rest of the diaphragm that you can see here actually is the muscular part of the diaphragm right here and also right there. Okay? Then as you can imagine, the kidneys actually are leaning on the muscular part of the diaphragm on the posterior abdominal wall. Okay. The other muscles that we want to actually review here are these muscles, or actually one on each side. Psoas major muscle right here. Okay, and I need to lift the kidney one more time. Thank you very much. So that is the psoas major. Then we have quadratus lumborum muscle right here. Then we have the iliacus muscle right there, attaches to the iliac fossa. Okay, now iliacus kind of they unite with the psoas major muscle, and these together form the iliopsoas muscle right here, and then iliopsoas muscle attaches to the lesser trochanter of the femur. We also have the psoas minor muscle. However, that muscle is absent in this person. So we do have another specimen that shows the psoas minor muscle. Now, the other structures associated with the muscles here that we want to see is this whitish structure here, which is called thoracolumbar fascia. And thoracolumbar fascia actually gives attachment to the transversus abdominis as well as internal oblique muscle. So let's look at these muscles. That is transversus abdominis muscle right there. Then this middle one is the internal oblique or internal abdominal oblique muscle, and that is external. Now these two actually attach to the lumbar vertebrae via this fascia, thoracolumbar fascia. So then practically these are the muscles found in the posterior abdominal wall. In this prosection, we want to show you the psoas minor muscle. So let's orient ourselves again quickly because it's different specimen. Kidneys, right, left kidney actually, aorta and IVC, right? So then you can imagine that is the left psoas major muscle, and that is psoas minor muscle. Here is the tendon of the muscle, and here is the fleshy part of the muscle, right? So, but interestingly enough, on the right-hand side, the psoas minor is absent. Then practically, as a normal variation, the muscle could be absent on one side or even both sides. That previous actually shot, you notice it was not any psoas minor muscle. In regards to the blood vessels in the posterior abdominal wall, we want to walk you through the aorta and the branches of the aorta, as well as the tributaries, IVC and tributaries of the IVC or inferior vena cava. Let's go with the aorta. So as you recall, aorta passes through the aortic hiatus here, okay, was at the level of T12 as you can recall. And then it goes all the way down almost on the left side of the midline, and at the end it divides in two branches at the level of L4, the left common iliac and right common iliac. And then each common iliac divides in two branches. Further, it divides in two branches, the external iliac and internal. And as you recall from our pelvis video, the internal iliac is the one goes into the pelvis and it supplies the structure inside the pelvis, whereas external iliac goes all the way down and then it goes to the thigh and becomes the femoral artery. Now let's go with the branches of the aorta. Basically, the branches of the aorta can be divided in two main groups, the visceral and parietal. And as the name implies, the visceral branches supply the viscera. And these branches are also subdivided into mini groups. The unpaired branches which are in charge of the blood supply of the gut tube, including celiac, this one, celiac artery, it does the foregut, the superior mesenteric artery, midgut, and inferior mesenteric artery, which supplies the hindgut. Then 3 unpaired visceral branches. Then paired visceral branches, it means we have 2 for each, are these. The renal artery, of course, which goes to the kidney, one on this side and one on this side, right here. And then, interestingly enough here, we have normal variation on this side, that as you can see, there is a extra branch to the right kidney known as aberrant artery. So it's just extra branch for the right kidney. And then other visceral branches, the paired one, gonadal, which is the general term. And as you can imagine, gonadal arteries will go to the gonads, and this specimen is male, then that artery is called testicular, whereas for female is called ovarian. So now let me walk you through the gonadal arteries here. Okay, so now here are the gonadal, actually this is gonadal artery, as I said, this is testicular, right? And then runs with the testicular vein, of course. So we've actually traced that later. Now, the thing is that testicular artery should be a branch of the abdominal aorta. However, here as a normal variation, it arises from the renal artery. Then that is a normal variation. However, on the left side, okay, so let me walk you through that. Here on the left side, then as you can see, the testicular artery right there arises directly from aorta. Okay, so the other, actually these are the visceral branches, the unpaired and the paired. Now, the second group of the branches are parietal. Then you can imagine they go to the walls. Now, when it comes to the parietal, the one which goes to the roof, it means diaphragm from the below, is called inferior phrenic. We do have one beautiful inferior phrenic artery here. However, again, normal variation. This artery arises from celiac trunk in this specimen. Okay? Then we do have the other branches on the back as part of the parietal. These are called lumbar arteries. And these are the lumbar arteries that also send branches through the intervertebral foramina to go into the vertebral canal. And the last but not least here, we have the median sacral. So right there, that is the median sacral artery. So these are kind of parietal branches of the abdominal aorta. By the way, for the visceral, we do have branches for the suprarenal gland, okay, known as suprarenal arteries, that because the suprarenal gland is being kind of dissected here, so we can actually find those suprarenal arteries here. Okay. Now, in regards to the vein, the big vein here we have is inferior vena cava, or IVC, and you can imagine the veins. The IVC is formed by the union of left common iliac vein and right common iliac vein, and each common iliac vein is formed by the union of external iliac vein, which is this one, and internal iliac vein right there, this one. Okay, then the right and left common iliac vein joined together form the IVC, and IVC runs on the right side of the posterior abdominal wall and eventually drains into by passing through the IVC. So this part of the IVC is being cut because it seems it was going through kind of the little bit of substance of the liver, and when we have removed the liver, so then the vein has been actually cut. So then eventually the IVC passes through the IVC opening or a cable opening and then drains into the right atrium. Now, in regards to the branches or tributaries of the IVC, the main one are the renal veins, as you can see, one on each side. We also have gonadal, or in this case again, testicular. You can see on the right side, it goes directly to the IVC, whereas on the left side, the testicular vein, or in female ovarian vein, drains into the left renal vein. That is not normal variation. This is just the regular or common pattern of the venous drainage of the gonadal veins on the left side. Okay, and that venous drainage has a clinical application, which causes actually or increases the incidence of the varicose vein on the left hand side. Okay, we also have the lumbar veins that unfortunately, or not unfortunately, practically we have detached them or removed them because we wanted to have the kind of the mobile IVC. In regards to the nerves in the posterior abdominal wall, we are going to actually focus on the lumbar plexus and the branches of the lumbar plexus. Basically, lumbar plexus is a somatic nerve plexus which is formed kind of behind the psoas major muscle. In some cases, we call that actually within the substance of the psoas major. In order to see the branches of the plexus, I need to pull the kidney to one side. I'm going to show you actually the nerve on the left hand side, and I'm going to actually lift the left side. And could you hold this for me, please? Thank you very much. Okay, so we can see the origin of the plexus because, as I said, the plexus is formed behind the psoas major. But for the branches, so from top to bottom, we have the subcostal, this one, and as you can imagine, the subcostal nerve is right underneath rib 12. So when you are actually reviewing the specimens here, so you can palpate the rib 12, then underneath is subcostal. Then below to that is iliohypogastric nerve, which goes towards the iliac crest right here. Okay, ilioinguinal nerve right there. That one goes towards the iliac crest and ACEs as well. Then we have the lateral cutaneous nerve of thigh, this one. And as its name implies, it does the skin on the lateral thigh. This nerve passes under the inguinal ligament, close by the ACEs, over here. Then we have the femoral nerve, huge nerve, really big nerve, coming off from the lateral border of the psoas major. This nerve passes under the inguinal ligament here, and that is the nerve of the anterior thigh muscles. The other nerve is genitofemoral right there, which is on the anterior aspect of the psoas major or anterior side. And this nerve has two branches, the genital right here and femoral. This is the genital branch that supplies the cremaster muscle. Okay, and the last but not least, the obturator nerve right here, which runs on the lateral wall of the lesser pelvis. Okay, passes through the obturator canal, and it supplies the majority muscles on the medial side of the thigh, the adductor muscles. Now, let me give you a tip that might help you to find these nerves in the posterior abdominal wall. The nerve, actually, in regards to this tip, the reference point is psoas major muscle. The nerve medial to the psoas major is obturator nerve. The nerve anterior to the psoas major is genitofemoral, and the nerve lateral to the muscle, which is thick nerve, is the femoral nerve. So then one nerve lateral, just close by muscle, lateral, one anterior, one medial, right? So then for lateral cutaneous nerve of thigh, you are going to find the ACEs, or anterior superior iliac spine. Then you can find the nerve close to that. iliohypogastric and ilioinguinal. Sometimes even one of them is absent, not easy to find. But we are fortunate enough that we have both of them in this specimen, but they are going towards the iliac crest here, right there. And then the subcostal, which is really easy, right? Because it's under the rib 12. Okay. Good to know, one of the important clinical application of the genitofemoral nerve is the fact that this nerve crosses the ureter. That is ureter coming from kidney, right? So then you can imagine that if there is a urinary stone inside the ureter going down, they can trigger the genitofemoral nerve.